Good day everyone, I am Michelle Montibon, your student nurse from Davao Doctors College, and today I am going to perform a demonstration of newborn care. Newborn care and safety are the activities and precautions recommended for new parents or caregivers. The purpose of this is to provide initial care of the newborn and to assessment to deter the spread of microorganisms and prior in preparing the material that is needed. So after that, properly identify the infant by carefully looking into or her name tag or wrist tag to identify the infant's identity. Make sure to enhance infant's comfort by keeping the environment warm to prevent heat loss that may cause hypothermia. Perform hand washing and then weigh the newborn correctly so that we will have our baseline data. So now we proceed to the cord dressing. So these procedures help us to prevent infection around the baby's cord stump. So apply sterile gloves, then properly restrain upper and lower extremities of the newborn. Using the operating sponge with ROH and disinfect cord 3 times upward to hold the baby in place to gain the proper access of the cord and also to protect the cord from contamination. So now put the sterile OS at the base of the cord and clamp the cord with an umbilical clip 1/2 inch from the base of the cord. So now cut the cord after using the clamp about 2 cm from the base after pulsating. Stop within 1 to 3 minutes after the birth to prevent anemia and intravascular bleeding. And then grab a OS and place at the base of the cord Now cut the cord about 0.5 centimeter above the cord clip and expresses the remaining blood from the cord with the OS placed on the base of the cord. So you can now place the OS at the base of the cord stump and pour 70% ROH over the cord. This is to ensure that the remaining blood is stuck within the cord of the baby and to provide the most optimum conditions for healing by removing remaining debris and contaminants from in and around the base of the cord. So you can now place the OS at the base of the cord stump and pour 70% ROH over the cord. This is to ensure that the remaining blood is stuck within the cord of the baby and to provide most optimum conditions for healing by removing remaining debris and contaminants from in and around the base of the cord. So now let's proceed in injecting vitamin K. This is needed for the blood clotting to prevent a serious disease called hemorrhagic disease of the newborn. So now withdraw the exact amount of vitamin K from the ampule and inject into the middle third lateral aspect of the infant's thigh. So now, let's inject the hepatitis B vaccine about 0.5 ml intramuscular. Then, inject the BCG vaccine about 0.1 ml intradermal method using the right deltoid. So, assuming that this is the BCG vaccine. So, the lateral aspect of the infant's thigh is preferred site for intramuscular injection for the reason that it is the most or the bulkiest part of the thigh. So this is to provide protection against the hepatitis B virus or the HBV right away, and vaccine given to the babies to protect them from serious form of tuberculosis. So next thing that we need to do is to carefully get the anthropometric measurement of the newborn, starting with the head circumference. After this, we need to take the newborn temperature rectally. So get the digital temperature, clean it with cotton, and then insert the metal tip in the anal opening and steady it with your second and third finger. So now let's proceed to the initial bath. Hold the newborn in football grip manner, folding both ears so that this will be prevent the water from entering the baby's ear. Then carefully washes the newborn's head with the use of baby soap or mild shampoo and wipes dry after. So mild shampoos is preferred for the babies because they are most likely to cause irritation to baby skin. So first hold the baby, then close the ear of the infant so that the water will not get inside to the ear. Then we pour the water. Note that the initial bath is done after 24 hours to maintain the vertex and to maintain heat and also to prevent infection. So now put on the baby diaper, shirt, mittens, and booties. So diaper is given to absorb and hold the baby's waist, while the mittens and booties protects the baby's finger and toenails from the trauma and also to prevent the baby from scratching his or her face. And then wrap the newborn securely with clean blanket to maintain the warmth and place the newborn in the crib with drop light and an attached crib tag. So now let's shade the newborn's eyes from light and open the eye at a time by exerting gentle pressure on the upper and lower lids to protect the infant from eye infection or ophthalmic neonatorum. So now apply the ophthalmic ointment from inner to outer canthus. Avoid the medicine tip from touching the newborn's eye. So expecting that it is ophthalmic ointment. Next is to get the newborn's vital signs, because this is good indicator of the newborn adaptation and survival, such as temperature, heart rate, respiratory rate, and saturation. So, and lastly, do the aftercare to maintain the cleanliness and record the procedure done and other pertinent data, so that this will serve as a proof that the procedure was done, and communication among the professional of health system through the exchange of information that concerns the patient.